Lipedema is also known as painful fat syndrome. This was actually the first aha moment I had and explained why any little knock, any blood pressure being taken, any playful pinch, or anything like that was excruciating and brought tears to my eyes immediately. I thought there was something wrong with me, but I didn't know it was lipedema. But painful fat syndrome absolutely resonated with me, and I prefer to call my lipedema painful fat syndrome because that's exactly what it represents as for me. The reason lipedema is painful is because of the mechanism of what occurs in the body. What happens is the fat, the lipedema fat, goes into an area in our body that we can't get to. It gets surrounded by collagen and becomes fibrotic. Now, this fibrosis, this fibrotic fat capsule is, think of it as sharp and spiky and all those kinds of things. It's like a little hard case. And whenever we knock up against it, because it's just under the skin where it shouldn't be, it hurts. It hits our skin from the inside out, and it is so painful. So that is why it causes us pain, particularly blood pressure cuffs. I don't know about you, but they absolutely render me with huge fears at the thought of having to have my blood pressure taken. Fun fact, when I woke up from gastric sleeve surgery, because my surgeon knew a little bit about lipedema, he'd had the nurses put the blood pressure cuff around my forearm, which they can do. So you can ask for that. I couldn't believe it. It was one of those life-changing moments, something as simple as, not having your blood pressure taken up on your upper arm, because I still had my big arms then. I hadn't had that surgery yet. It was such a relief to not have to have that done. So the other thing that happens with the fibrosis and the balls of fat in this hard case is it presses up against nerves and blood supply, just makes everything else more painful. I'm not sure if you've had pinched nerves. I've had a pinched nerve simply from coughing. I didn't know of the effects of lipedema. In fact, this is long before I even knew I had lipedema. And the pinched nerve caused my entire left arm to be numb, and I ended up in the emergency room because the nurse, when I rang the hotline, the health hotline, said, you either get somebody to bring you up here now or I'm sending an ambulance to come and get you. They weren't mucking around, and I was hooked up to heart monitors and all sorts of things overnight. Nothing wrong with my heart. And it wasn't until I went to a chiropractor the next day that he said, oh, no, that's the second time I've seen that this week. It's a pinched nerve from coughing because I had some kind of flu or whatever. Long before COVID, it wasn't that. So it's much easier for us to pinch nerves and things like that because of this fibrotic fat balls that we've got under our skin. Another thing that causes pain in lipedema is the fluid and inflammation. We already have compromised lymphatic flow, and our circulation is compromised also because of the mechanisms in our body and our compromised lymphatic system. Because of that compromise, it promotes fluid retention, and that causes inflammation. Anywhere we've got extra fluid, we will get inflammation, and then there's a tightness, and that causes more pain again on top of the already fibrotic issues that we've got going on. Now, here's another thing that I learned recently is something called biochemical amplification. Many women with lipedema, and the men, there are a couple of men out there, it's like we're super sensitive to the pain that we get already, whereas most people, the pain caused by some fluid retention or inflammation and so on might be a 2 or a 3. For people with lipedema, there's an amplification of that, and it might be more like a 7 or an 8. So there's an enhanced sensitivity to pain signals, which increases the pain levels in every area. So what's our core strategy here? And I talk about it in most videos. It is controlling inflammation and keeping our hormones steady. That's the only tools that we've got to work on. There's lots of little things within those two categories, but that's what we've got to work on. That's all we've got to work with, and we've got to play it for everything we've got, and we've got to attack it from every angle and every thought process that we think might be helpful in any way. Because even though we all have lipedema, we still have different versions of lipedema. We still have different symptomology of lipedema depending on our diet, our lifestyle, our genetics, our very specific, unique version of ourselves. You know, the air we breathe, the bacteria in our environment, they're all different from one another. So it's up to us to try everything possible to reduce the pain levels of lipedema. So let's look at the basics. Anti-inflammatory diet. The very, very basics of an anti-inflammatory diet is eat real food. Only eat food that you know what the ingredient is, a whole potato. And I say potato, even though for most people you shouldn't be having carbs anyway, that will contribute to problems in lipedema. But it's a really good example of a potato compared to a French fry or something like that. Very different beasts. This one, very inflammatory, French fry, and the potato, not so much. It's better. It's, you know, I've done a few videos on good, better, best. Eating real food in whole food form will make a massive difference right from the get-go, particularly if you already follow a high processed fast food type of diet. So if you can start making food from scratch or employing a person that sends you food that's made from scratch, that will be far better than the ready meals in the supermarket that has got a million different numbers. Every one of those numbers represents a chemical that our body does not know what to do with. And since we have a compromised body as it is, we cannot add that burden on top of it. But if you want to get really into the anti-inflammatory diet thing, then yes, carbs and grains particularly are really not great for us. There's been so many studies and trials around this that low carb, no grains is very beneficial for lowering inflammation in the body and for lowering pain levels. Because when you go on a low carb or a keto diet, you produce ketones. So your body starts burning fat instead of sugar, and those ketones are anti-inflammatory. So you get a pain reduction by eating that way. So the other foods that cause high inflammation are seed oils. Now, this is everywhere, the vegetable oils, because they are high in omega-6s. And you hear omega and think, oh yeah, but that's healthy, isn't it? It is not. Okay, omega-3s and omega-6s. We need the omega-3s. They are anti-inflammatory. We do need to a degree omega-6s, but we need them in the ratio of 1:1. So 1 part omega-3 to 1 part omega-6. Unfortunately, in our world and in our current state of processed foods and quick foods and our busy lifestyle and everything going fast, we're having about 1 part omega-3. The latest report I saw was to 40 parts omega-6. That's where it's become inflammatory. Vegetable oils are in everything. Everything processed that's been pre-made has a vegetable oil in it. I even found it in my favorite mix of herbs and spices. Why there needs to be vegetable oils in a bottle of herbs and spices, I don't know, but it was in there. Perhaps if you're using vegetable oil just to cook a steak once a day and you're using like a teaspoon, it might be fine. But it's in everything. Everything that's processed, we're getting this at almost every single meal a day. So that added inflammation to the body, we can do without with lipedema. We need to do without. So an anti-inflammatory diet is key as a core strategy. Stress management is the next key under your core strategy. We've got to deal with our stress. Stress causes a rise in cortisol in our body, and that is inflammatory. I don't know how to say this to a degree that really lands for anybody watching this. If we are stressed, that equals inflammation, and those two together equal a progression in lipedema and therefore a progression in pain levels. They have shown that breathing, proper deep breathing into the diaphragm, and there's so many apps on this, that is the quickest way to reduce cortisol and to reduce stress levels in the body. So breathing exercises need to be one of the things that we incorporate into a daily regime. And I have to admit, it's the one thing that I don't do a lot of, even though I have a very good friend who her whole practice is about teaching people to breathe. I need to have her on the channel. Also, if we keep in mind that a lot of our lymphatic vessels meet in the stomach. If we're doing the diaphragmatic breathing, that's going to stimulate the lymphatics in that area so that our lymphatics as a whole works better and moves. When we reduce the stress in our body, the cortisol, and calm the autonomic nervous system, that in turn reduces inflammation, and inflammation equals pain. Now, the final thing in our core strategy, we've done the diet, we've done the mental side of things, and now we're looking at the movement as a core strategy here. We need to move. Even though it hurts to move, we need to move in a safe manner that helps to reduce the inflammation in our body and therefore reduce the pain. The reason we need to move is for the lymphatic flow. If we don't move, our lymphatic fluid is like butter. If we're cold and stagnant and sitting in one position, it's like hard butter out of the fridge. If we are moving and flowing, it is like melted butter. And that's what we need to get our lymphatic fluid to flow and to return back to where it needs to go and to dump into the bloodstream and all of the things that we need to happen for lower pain levels with lipedema. We need to find something individually that works for us, that we semi-enjoy. I can't say that anybody with lipedema that's out of control enjoys exercise. So I think that's just to say, I'll find something you enjoy is ridiculous to me, because for years, for decades, there wasn't anything I enjoyed. That's ridiculous. So find something that you're willing to do that doesn't cause you too much pain, that fits in with your lifestyle, that you can commit to. I'm not going to say enjoy. Maybe eventually you'll enjoy it. I don't know. But you know what I'm talking about, right? In the pool, if you live in a hot environment, if you live in a cold environment but have access to a heated pool that is warm and feels good, get in the pool, move. Doesn't matter if you don't do anything in that pool, just move in the pool for an hour a day or something like that. That's going to be your best friend. I have seen pools here in Bangkok that have got bicycles under the water. I never thought I'd see that. So that you can get in and ride the bike with the compression of the water on your limbs, which will lower the pain and get you to move. The only thing that you're trying to achieve here is to get all your lymphatics flowing, lower inflammation, and therefore lower pain. It's a mistake to think you're exercising to try and lose weight, right? That's a mindset shift you've got to make. No, you're exercising and you're moving to lower your inflammation and to have less pain. That is your purpose for moving. So if that's being in a pool, if you have access to that, if it's walking and you can do that, go to a supermarket, lean on a trolley, walk for as long as you can, go back the next day, go longer, go further. Don't worry about if anybody's looking at you and judging you. They're not paying your medical bills. They're not feeling the pain that you feel every night when you lie in bed with tears in your eyes. This is up to you, okay? I would suggest compressions when you're exercising, unless you're in the pool, because the pool gives you the natural progression of the water on the limbs, which is why it's so much easier to move in the water, right? Compressions the rest of the time. If you're walking around the shops every day, leaning on a trolley, that kind of thing, compressions will be your best friend to help with that movement. Let's look at conservative and mechanical therapies now. What can we do for lipedema pain relief? Manual lymphatic drainage. If you can afford it, if you can find somebody who knows what they're doing with lymphatic drainage massage should be barely noticeable. It's literally this kind of thing. If it hurts, if they're pressing too hard, they don't know what they're doing. So be very careful that you find somebody who understands lymphatic flow. When I was seeing a lymphatic drainage specialist, she was a physio in Karratha in Australia. She started up here. And for the first several sessions, she only worked around here because, as she said, unless your lymphatics that dump into your bloodstream here are unblocked, it doesn't matter how much she does down here or down on the lower body, it's going to hit a roadblock. It won't go anywhere. So if you've got somebody who knows what they're doing, they will start around this area to unblock that area where it goes into the blood. So that's probably a key tell of somebody who knows what they're doing. They will start up here and the movements will be really soft. Now, for some lipedema women, even that softness will be really sensitive because you don't like anything on your skin. But manual lymphatic drainage should not be painful in any way. Moving the lymph over time and getting it to move out, that's what helps to lower the inflammation, because you haven't got stuck toxic garbage sitting in your system, sitting in your body. That's how it helps with the pain relief. It removes fluid, and removing the fluid helps to lower the inflammation, and inflammation equals pain. Right, that's the takeaway to this one. Inflammation equals pain. So anything we can do to reduce inflammation is going to reduce pain and give us relief. Research has also shown with manual lymphatic drainage massage that it improves sensitivity. So if you're that person that has sensitive skin and it just hurts, bearing with it actually improves the sensitivity, which improves the outcome when it comes to pain, and your pain signals calm down a little bit. So it may be helpful if you're that hypersensitive person on your skin to find somebody who understands that and to bear with it and see what changes for you. Now, I've already touched on this, but compression therapy is another way to lower the fluid, lower the inflammation, and therefore lower pain in lipedema. When you're looking for compression garments, they need to have a medical grade of 25 to 30 millimeters of mercury in compression. What they do is they keep everything contained. It helps the fluid to push back up to where it needs to be. It helps the lymphatics to push back up where it needs to be. They've shown that compressions can absolutely reduce inflammation and reduce pain levels. From a mechanical perspective, we have pneumatic pumps out there, and they vary in price from what I've seen, $600 to $3,000. I have never tried one. I went to hire one when we lived in Australia, but I hadn't lost weight at this point, and they didn't fit me. They were too small, but they were standard pneumatic pumps. They weren't made for lipedema women. I went along, and luckily she let me try the legs, because I was that person like you that was never able to wear boots or anything like that. So straight away, even though I knew I could hire this to test it out, I was very dubious that they would fit my legs, and they did not. So if you are looking into the pneumatic pumps, they are amazing for lymphatic flow and venous return and getting the fluid out of the limbs. But just make sure that you deal with somebody that understands lipedema and get the right size for your body. Research has shown that the combination of manual lymphatic drainage massage with pneumatic pumps significantly decreases pain levels, because it's decreased the inflammation and the fluid retention in the legs. So it may be an option for you, and it's something that you don't have to cause pain to yourself to actually carry out. If you're immobile and you can't leave the house, that kind of thing, you may be able to find an MLD practitioner that will come to your home and then pop on your pneumatic pump afterwards to help reduce that pain and inflammation and get the fluid moving again. The other thing that's from a mechanical perspective is the vibration plates that seem to be everywhere now, and they come in small versions that you just stand on and slip under the bed, and I've seen big ones that you hang on to for dear life. So what these vibration plates are said to do is to move the fluid, loosen up the fibrotic tissue, and stimulate muscle activity. Because often we become immobile, we don't want to exercise, our muscles waste away. Use it or lose it kind of thing, right? The vibration plate helps to strengthen the muscles. I don't know how it loosens the fibrotic tissue, but there's enough people using them now for me to say they may be worth looking at. I found one in a secondhand shop here in Bangkok just recently, but it was one of the big ones. And with this small condo, I do not have space for that. So if one day I find a nice little one to just stand on that I can slide under the couch or the bed or under this desk, I'm all up in it. I'm going to give it a go. But that may be another option. And again, it's an option if you're particularly immobile, because you don't have to do anything more than stand and hold on for however much time you're on it. So it may be something that you can consider that is just that step down from, oh, I just can't go for a walk. I just can't move my body in that way. This may be an option for you. Be careful though with vibration plate. If you're hypersensitive to touch, The feeling of vibrating may cause that sensation on your skin, and you may not like it because it increases your circulation. And when your circulation's increased, so you know when you get pins and needles and the blood rushes back, you've moved your arm and the blood rushes back, and it's that really weird sensation. So if you've got hypersensitive skin, the vibration plate may not be for you. Also, if you have hypermobile joints, that may not be for you because it may move you around too much, but it depends on how bad your joints are. For the most part, if you're just standing, you should be okay. But again, work with your physio, work with your doctor, work with whoever you need to, whoever your health professional is, before you choose any of these sorts of mechanical issues to see if it's going to be a problem with something that you haven't considered in your body. It's their job to know what your body's doing and what it can cope with and not cope with. It's your job to just know emotionally and mentally what you can cope with. Let's look at targeted interventions. And there are a few here which may be unusual. But as I said earlier, any way that we can reduce pain with lipedema, we must consider it at the very least, if not try it. So the first one is low intensity ultrasound. And this is kind of a pulsing wave that goes through your body. It is said to help with the rigidity of the lipedema fat that's encased in the little balls, which improves the sensation of pain because of, if that's softened, then it's not such a harsh thing against your nerves, your muscles, or even if you hit yourself, that kind of thing. So that may be an option. I have not tried that. That's just what I found in research, that you can get this type of therapy. From a dietary perspective, GLP-1s that are getting a lot of attention now, they have shown to improve pain in lipedema time and time again. So much like weight loss surgery that I had, if GLP-1 improves your pain levels, your inflammation, your quality of life, block out the noise of what people are saying about it or, judging you for. Don't tell anyone and just try it if you can afford it financially. However, the only problem there is financially, you've got to be able to afford it for a long time. Originally, when GLP-1s came out, I had the choice of GLP-1 weight loss surgery. But to me, I wasn't going to pay for the GLP-1 for the rest of my life. So that's why I went with the weight loss surgery, because it was kind of like, right, I can get back to square one and keep it at bay that way. Just be aware of the ongoing cost. If it's really great for reducing your pain, I don't know if there's any kind of medical assistance, medical insurance. As time goes by, they might contribute in that way because of once they understand the pain reduction. Who knows, right? We can only hope. But GLP-1s definitely have proven their worth when it comes to lipedema pain. And I would say also, often that comes to many of the people that are on GLP-1s go to a keto type diet and they can actually keep up with it because the GLP-1s help with food noise and that kind of thing. And once you're on a keto diet long term, the ketones are being produced and ketones reduce inflammation, which then reduces pain. If you're sticking to a keto diet, but you can't stick to it, you start it and stop it, start it and stop it, the GLP-1 will help reduce food noise, help you feel satiated so that you can kind of stick to it longer. But again, the big downside is the fact that you've got to kind of pay for it ongoing forever. And it's not a cheap thing to access. Herbal options. I'm going to do a video on this one. Butcher's broom and selenium combined have shown to reduce inflammation in the body. It improves swelling and therefore pain. That may be an option and fairly harmless option to test out, right? Butcher's broom, go to a herbalist. I haven't actually tried this. I have had a dispensary in my clinic when I was in Australia. Never actually tried it because I didn't do the research into understanding just how valuable it is for our lymphatics and the combination of selenium. I already take selenium in most days because it appears so many times in the thyroid pathway. So it's just kind of a no-brainer for me. So adding the butcher's broom, I'm going to have to give that a shot. But that will be a challenge down the track and I will bring you the results as usual. But you may want to find a herbalist. Make sure that there's no interactions with anything else that you take because there's no point in wasting money on any good herbs or supplements If you're already taking a medication that negates it, or you're already taking a supplement that if you take it together negates it, that's why you pay to see somebody for these things, so that you're getting your money's worth when you actually use the supplement. People say it's a scam and all that sort of thing. It's not. What's the point in taking something ongoing if it is not really doing anything for you? So that's why we do it. Now, finally, the other targeted intervention that we have is surgery, liposuction. Not everyone can afford that. And it's not a definitive answer. If you have your surgery, you've had all the lipedema fat extracted from your body, because this is something you're born with. If you go back to eating a high inflammatory diet, sitting all the time, not moving, being in a life that is full of stress and trauma, you will grow it back. I've seen so many videos now where people complain of, oh, he mustn't have been a good surgeon because it just came back. But they didn't change their lifestyle. So the same rules apply before surgery as they do after surgery. The surgery in my arms, that will come back if I don't follow an anti-inflammatory diet, if I don't keep my thyroid hormones stable as a rock, if I don't keep my blood sugars stable as a rock and don't have my insulin going up and down. That's another big cause of hormones going out of control. If I don't move, then I'm going to get stagnant fluid swelling in my lower legs, which is going to cause inflammation, is going to cause pain, is going to grow lipedema. All of these things, it doesn't matter what stage you're at, and if you can afford liposuction and the surgery, great, awesome. It will reduce your pain, absolutely. But if you continue to lead the lifestyle that promotes the inflammation, then you're going to continue to have problems with pain. So surgery is not a cure. It's a tool. Like weight loss surgery for me was not a cure. It's a tool to help me on my journey to have a better, more fulfilled, more happy, pain-free lipedema life. So pain relief for lipedema requires a holistic view. Physical, mental, and emotional, if you haven't worked that out already. And that's what I'm all about. Okay, you've got to address it from all areas. Physically, the anti-inflammatory diet, movement, mentally, knowing about your body, understanding your disease, being clear enough with yourself that you know what it is you have to do. Emotionally, keeping the stress down so the cortisol isn't running low-grade cytokines, inflammation in your body 24/7. If we don't address all of them, something will still continue to spike the inflammation and the pain will continue.